Welcome to our comprehensive guide on mastering infection control in dental practice. In this video, we'll explore essential topics from dental radiology to emerging trends. First up is ensuring a sterile environment during radiological procedures is paramount for patient safety. Here are some practical tips to maintain sterility. First is to ensure proper hand washing before and after the procedure, wearing the appropriate PPE. Third is to ensure that all equipment used during the procedure is properly sterilized or disinfected according to manufacturer guidelines. Fourth is to minimize the number of people entering and leaving the room to reduce the risk of introducing contaminants. Fifth is to maintain a clean and clutter-free environment by regularly cleaning and disinfecting surfaces and equipment in the procedure room. And lastly, disposal of all contaminated materials in designated biohazard waste containers.
And now, let us discuss the occupational health and safety in a dental setting. Here are the key elements to prioritize the well-being of dental professionals, creating a workspace that's both safe and conducive to productivity. First is to train staff rigorously in infection control protocols and ensure strict adherence. Second is to invest in good equipment for minimizing cross-contamination and airborne pathogens. Third is to organize workspace layout to facilitate infection control measures. Fourth is to implement a strict schedule for cleaning and disinfection of all surfaces and equipment. Fifth is to establish proper protocols for handling and disposing of infectious waste. And sixth is to ensure that all staff have access and consistently use appropriate PPE.
Infection control in specialized dental situations can present unique challenges. Innovative solutions include customized protocols, advanced technology like laser sterilization, remote monitoring, simulation training, disposable tools, collaboration with experts, continuous education, and patient involvement. These measures ensure effective infection control in specialized dental situations.
Stay ahead with the latest trends and advancements in infection control. First is the UVC disinfection, increasing the use of UVC light for disinfection of surfaces and air in healthcare facilities, especially in high-risk areas. Second is the automation and robotics, integration of automation and robotics for cleaning and disinfection tasks, reducing human error and improving efficiency. Third is the nanotechnology, utilization of nanotechnology for the development of antimicrobial coatings and materials offering enhanced protection against pathogens. Fourth is the wearable technology, implementation of wearable technology such as badges or sensors to monitor hand hygiene compliance and track the spread of infections in real time.
Audits help identify areas where infection control protocols are not being followed correctly or consistently. These could include lapses in hand hygiene practices, improper disinfection of surfaces, or inadequate use of personal protective equipment or PPE. By pinpointing compliance gaps, audits allow healthcare facilities to take corrective actions promptly. Audits ensure that healthcare providers adhere to established standards and guidelines, promoting a safe and hygienic environment for patients receiving treatment. Infection control audits also safeguard the well-being of healthcare workers by ensuring that they have the necessary knowledge, resources, and support to protect ourselves and themselves from exposure to infectious diseases.
Ongoing training and education are key to maintaining infection control standards. Here are the methods for keeping dental staff updated on best practices. First is the reduction of healthcare-associated infections. Well-trained staff are better equipped to identify and mitigate infection risks, leading to reduction in HAIs. Proper hand hygiene, sterilization techniques, and proper use of personal protective equipment or the PPE are critical aspects taught in training that are directly impact infection rates. Training enhances the ability of healthcare professionals to protect both patients and themselves for the spread of infectious diseases. By understanding how infections are transmitted and implementing preventative measures, they can create safer environments for everyone involved in the healthcare delivery.
Let's wrap up with real-life case studies showcasing successful infection control measures. Case study title is Reducing Surgical Site Injections in a Hospital Setting. Background of the study is a large urban hospital identified a concerning trend of surgical site infections or SSIs. Following certain procedures leading to increased patient morbidity, prolonged hospital stays, and higher healthcare costs, the hospital administration recognized the urgent need to implement effective infection control measures to address this issue. Implementation is the conducted a risk management, formed a multidisciplinary team, developed evidence-based protocols, conducted staff training, enhanced surveillance and monitoring, and lastly is engaged patients through education. Result of the study: reduce SSIs across all surgical specialties, timely identification and management of SSIs, high staff compliance with protocols, increased patient satisfaction. Conclusion of the study: through a systemic approach involving multidisciplinary collaboration, evidence-based interventions, staff training, enhanced surveillance, and patient engagement, the hospital successfully reduced the incidence of SSIs and improved patient outcomes. This case study highlights the importance of proactive infection control measures in healthcare settings and demonstrates the positive impact of comprehensive strategies on patient safety and quality of care.
Thank you for joining us on this journey to masterizing the infection control in dental practice. Remember, by prioritizing safety and staying informed, we can create healthier environments for both patients and dental professionals. Don't forget to subscribe for more educational content. Until next time, keep smiling!